All right. Good evening, everybody. I'd like to call to order the November 13th Program and Budget Committee meeting. With that, I will read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, we'll move on to the adoption of the agenda. Motion from Megan, support from Linda. Any questions? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? The agenda is adopted. Next is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. We are recording you. Give us your name and address. We can't respond, but staff can later. All right, going once, going twice. We will close public participation. Next is request to approve item A. Request to approve the interagency cash transfer agreement between Michigan Rehabilitation Services, MRS, and Macomb County Community Mental Health. Take a motion to approve. Motion from Lori, support from Tony. Is there anybody that wanted to speak to Dave?
Just briefly, I met with Crystal James from the Michigan Rehabilitation Services. I am familiar with the interagency cash transfer agreement process. It's kind of, it's a wonderful program. You give the state $1 and they give you $4 back in return. These agreements are reportedly long-standing between our community mental health and Michigan Rehabilitation Services. One is specific to Mocoso. I did attempt to get some more detail about how these monies were spent or not spent previously. Have not been able to reconnect with Crystal since I met, but we are following up. It is our goal to increase the employment services that we offer, and specifically now we're working to implement a project search classroom. That some of these we might end up doing another separate agreement or using part of this, but that program will support a classroom from the Macomb Intermediate School District who are in special education at a local host business site too. So we need to increase the employment services. Macomb is, we're underutilizing that service, and these agreements will help us do that.
Thank you, Dave. Any questions? Nick?
Not a question, just a comment. David alluded to it. I asked him before the board meeting how much of this was actually used or how much lapsed back, and didn't lapse to us apparently. It lapsed to the state, which worries me even more. So I don't want to hold it up now, but I'm hoping we'll have that additional information by full board from Kristen.
I apologize. I did get, I have additional detail. I can attempt to summarize, but I will get this letter out to the full board. There was a summer work program for transition-aged youth. They had over 100 students participate in a 6-week work-based learning experience through Macomb County. They've done vocational assessments with these funds. For fiscal year 2019, their goal was 136 applications or intakes. Actual was 102. Plans for employment, the goal was 89. Actual was 54. Successful employment outcomes, the goal was 47. Actual was 29. So our goal for 2020 would be to increase those numbers of eligibles and successful placements.
Nick, did you have a follow-up?
Yeah, well, I don't think you answered the other two pieces. Maybe you can wait. where does the money go if they don't spend? They can only spend it on these services. So if it isn't spent, it lapses somewhere, but apparently not touched. So it would be helpful to know that. And two, it would be helpful to know your plans on how to have more people get into these programs, because they're very much needed programs. Nobody questions that, but apparently either people aren't hearing about them or for some reason aren't connecting. Oh.
Thank you. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion is approved. Next is item 5B, request to approve the interagency cash transfer agreement between Michigan Rehabilitation Services, MRS, and Macomb County Office of Substance Abuse. I'll take a motion to approve. Motion from Kathy, support from Brian. Go ahead, Randy.
A ditto to what David said.
Perfect. Any questions for Randy?
I'm sorry, I was flippant on that, but we have a similar problem. We don't have much money invested in this. We've done this for 15 years. It's $10,800 each year. This is the first year we've actually dipped below our plan. We've always spent our full amount of money, and therefore we haven't. So we have arranged a meeting between the major players on that, including Crystal, and we'll for next week, and we're trying to find out what happened this year. I kind of have some idea, but I don't really know for sure, because I think it's a combination of care taking on a whole lot of new responsibilities in addition to that. And I think MRS, Crystal James, is new. She took over as director within the last year, I believe. Those kind of things do impact. $5,375 was lapsed at our money, and to my knowledge, it goes back to the state, and we have no recourse to get it back. But typically, we're in a much better shape because we get, like David said, you get $4 for every dollar we invest. So, okay.
Nick?
Do you have a plan as to how to make sure we utilize? I mean, it's nice to get $4 back for every dollar we invest, but if we lose $4 for every dollar, I mean, you've lost half of them. You said you put in 10 and they lapsed 5 of our money.
Yeah, well, the plan that I have is for us to sit down and meet.
Gotcha.
And that's what we've got scheduled for the 20th of this month, so that we can sit down and figure out how can we make this better. And when they sent their report back to us, they said, let's see if we can find a way to enhance this more than what we got. So they're very amenable to it. They don't like.
Was the lapse the $5,000 or $20,000? $25,000.
Well, if you take that in total, that's potential. The only actual dollars that lapsed was our $53.75.
And they didn't get the $3.
They didn't get whatever they didn't use.
They didn't get the match.
Yeah, they got the $5,375 times.
Gotcha.
3.
So they actually lapsed a lot more.
Yeah. Yeah, they did. They got hurt more than we did. So.
Any other questions for Randy on this one? All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion is approved. Next is item 5C, request to approve ratification of the fiscal year 2019 Mocoso contract with Families Against Narcotics. I'll take a motion to approve. Motion from Megan. Support from Chris. Go ahead, Randy.
Okay. This is not one of my prouder moments. What basically happened is we're asking you to, what's the word again?
Retroactive.
Yes, that. To ratify an agreement that you already approved last year. And the reason that we're asking you to do that is because somehow we inadvertently did not execute the contract between FAN and us. And we didn't find out until FAN asked us in October this year, can we have a copy of our contract? And we went to find it, and we couldn't find it. And then we talked to corporate counsel and got their opinion what we needed to do to make it right. They provided services all year, and they were within the, they were within the confines of the contract. And we paid them all year, but we just wanted to make it right. So they suggested that we ratify the contract. Yeah.
Nick, Linda's up.
What was the service, Randy, under this
Oh,
contract?
I'm sorry. That we gave them $75,000 to do the public education on overdose awareness education and distribution of Narcan. They're one of 3 providers that do that for us. So,
Thanks.
but they were a new provider last year. So.
Nick?
So you're saying we actually did approve the contract and then you just didn't execute it?
You approved the actual, because they were new, they came out of an RFP. If you may recall, last year was one of 3 agencies that we approved, and you approved that. Then you approved the master contract, like I hope you're going to do again tonight. So that was approved at that point.
Right.
And not officially for, not all the details of the contract for that particular contract.
So we actually did approve it. We're just doing it again because it wasn't formally executed
Right.
by the parties, but it was enacted by
Yes.
both parties.
Yes. We're just covering our butt.
That's why we're asking Randy to leave here in the next month or so. Just kidding, Randy. Any other questions or
Waiting for
comments? All right, seeing
miss
none,
me.
we have Tony, go ahead.
I got a comment. I don't know whether it's an error, mistake, an omission, or whatever it is. But on page 50 of this, which is an appendix page, it's the last page of the item C. One of the insurance companies that listed there is called Fidelis, and I believe that is not true anymore. That is called Michigan Complete Health. Now, whether that directly affects your contract or not, it probably should be corrected.
Okay. Well, I think that's something that would probably be best dealt with because this is contract on all of the contracts for all of the providers for us. That would be, if that's the case, we'll look into it.
Yeah.
And add it to it, I would think. And,
In 2017 is when Fidelis lost its name, I believe.
Okay.
That might be verifiable.
I'm sorry, what did you say the name of it was again?
Fidelis, Fidelis, and the new name company is Michigan Complete Health.
Okay. Okay.
Thank you.
Thank you, Tony. Any other questions or comments? All right, seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is item 5D, request to approve the fiscal year 2020-2021 Mocoso SUD provider contract. I'll take a motion to approve. Motion from Brian. Support from Dana. Go ahead, Randy.
Okay. Excuse me. This is a contract you approved last year, only with this year's version of it. It's a master contract for all of the provider contracts. There's very little change that occurred with this, just very minor changes like citations and some references. The major change this is for us a major change, not on the mental health side, but we've moved it from a 1-year contract to a 2-year contract. So that will be on the same contract cycle as the mental health side. So we'll all be one happy family.
Any questions or comments on this item? All right, seeing none. Dave, did you want to? Dave's going to jump in real quick.
Through the chair, Randy, on page 51 of your contract, Appendix 10, it does list Fidelis there as well.
Okay.
So.
Thank you, Dave.
So we would ask that that change be made if necessary.
Any other questions or comments? All right, seeing Kathy?
So
You'll find out if it needs to be changed, and then we'll have the language at full board then.
Yeah,
Whichever
we can
name
do that.
we need to have. Okay, thank you.
Linda?
Just a comment, these are all the MyLink ICO providers, so if all of your contracts may have that.
Yeah,
'Cause
yeah. Well, this is a
Did you say
master
that? Did somebody
contract,
say there
so
was
if we
one?
change it, we have to change it in one, in the master contract, and it'll go out with all of them. I think I said that right.
All right, anyone else? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is 5E, recommendation to add residential treatment to the Mocoso fiscal year 2020 contract with Quality Behavioral Health. I'll take a motion to approve. Motion from Linda, support from Brian. Randy, go ahead.
Okay, Quality Behavior Health is a treatment organization, treatment and detox organization that we've contracted with for detox only for several years now. I don't know the exact number, but we've had a good working relationship with them. They do good quality work and so forth. And as you recall, we've been looking for the last 3 years and trying to increase our number of beds that we have available for people that need treatment. The demand for residential treatment has always been there and continues to be there. They are asking to add residential treatment to their list of services that they would provide for us. As I indicated in here, they had capacity issues before now, so we weren't able to do that. Now they've moved to a new facility. We're an older facility that they renovated quite well, I would add. And they are located in Detroit. I guess we're recommending that they would get the residential treatment. It would allow us to have more beds available. It would allow more continuity in treatment, because the reason they do detox only is because we have some residential providers out there that don't have detox. And most of our clients need to have detox services before they can go into residential. So they provide that upfront kind of service for us. And then after, with this would allow us to do that, but it also allows, we prefer to have clients go through detox and residential in the same facility. There's just less chance of losing them from one level to the other. And so that would allow us to do that. They also have, as they noted in the letter that came with this, they provide MAT services as well on an outpatient basis, but they also can provide all three, methadone, Vivitrol, and Suboxone MAT services at the residential center, and so that they can start them up there and then send them off in outpatient, either their facility or another facility that offers MAT. So that's a big plus for us. And I guess that's it. I'll take any questions.
Any questions on this one? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Thanks,
Thank
Randy.
you very much.
Next is item 5F, request to approve the updated MCC-MH MCO policy 10-060, determination of financial liability. This item and the next item were moved from last month's meeting so we could get some explanation on these two items. So I'll take a motion to approve 5F before we get an explanation. Motion from Kathy, support from Linda. Alrighty.
Any questions from anybody? All right.
Can you just give us a brief update on what the change is?
Okay, sure. I'm sorry.
Thank you. That's okay.
The policy first, Chapter 10, is a directly operated provider policy regarding ability to pay and processes. It was very long. It was very cumbersome and very old, and it was updated to match more carefully the Chapter 7 policy on the same subject matter that's applicable to our contracted providers. So basically, our contracted providers. And so we removed all of the processes, the procedures, And because most of those were outdated, they were old, it was probably a 10-year-old policy. And our internal processes changed, but we didn't update that policy. And so we've decided now to keep it slim, and any processes associated with that would be internal with finance and budget and so forth. So, so we have now 2 policies that are very similar. One in Chapter 7 for our contracted providers, and actually it does say it's for both. And then this Chapter 10 one for just the directly operated providers for anything that's just really specific to the our directs. So
Thank you.
that one.
Any questions or comments? Nick?
Well, you answered my first question, was if this was since this was applying to direct provision, why wasn't it applying to contracts, but you just put it in a different place. That's fine. There are 2 additional questions I have that are related. I look at O on the limitation of spouse's ability to pay, and Michigan has a spousal impoverishment law. And I also would note that there's a financial liability limitations in the mental health code itself. I think it's Chapter 11. Do these all meet all of those?
I can tell you it does meet the one in the mental health code,
Right.
but I will have to check for you to see if it takes into consideration the spousal impoverishment code. So can I?
Basically what the spousal, and it's a Medicaid piece, and of course that's a good hunk of our business, says that rather than letting, if one spouse gets ill, you don't exhaust all of the assets.
Oh.
You exhaust half of the assets.
That should be in there, yes. That
Well,
should
there's
be in
something
there.
here, so it shall be limited to 730 days of inpatient or residential services during the lifetime of the individual. But I didn't see anything on the splitting of the assets so that you can only essentially take half of the assets, the other assets,
Thank you for bringing that up. I will bring that back.
to the full board.
Yes, I can do that for you.
Okay, thank you.
I might have to bother you again to get exactly what you're talking about.
Pardon me?
Just a minute. I might have to bother you to get exactly what it is that I want to
You got
make sure.
my
I want to
number.
make sure that I understand.
You got my email.
completely.
Barb has my email.
Excellent. Okay, just I want to make sure I answer the question exactly as asked. So, thanks.
Any other questions on this item? All right, we have a motion and support to approve it to full board. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is item 5G, request to approve revised MCCMH MCO policy 9-610, recipient rights privileged communications. I'll take a motion to approve. Motion from Chris, support from Brian. All right.
Okay, so basically this was just a cleanup. We were reviewing a request for release of information, and we needed to look at it, and we noticed that the legal authority included provisions of the mental health code that had been repealed. So we cleaned that up, and it didn't impact at all the content of the policy. It reads exactly the same way as it did prior to the revision. It's just a cleanup, so.
Thank you. Any questions or comments on this item? All right, seeing none, we have a motion and support. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thank you very much. Next is item 5H, request to approve contract with Pediatric Special Care, Inc. for the provision of private duty nursing for enrollees on the Habilitation waiver and for nursing respite beginning November 1st, 2019 through September 30th, 2021. I'll take a motion to approve. Motion from Linda. Support from Lori. All righty.
So this provider, this board actually approved a single case agreement at our last meeting, and since our network adequacy has had some issues with private duty nursing, we're seeing we need to have additional providers, and offering this provider, things have gone really well. Additional folks, referrals will really help us out. So that's why we want to offer them a full contract. Any questions?
Any questions or comments? Linda?
So they're already providing the service, when you
To
say
only
offer
one
them a full, you
person.
mean they have a half, for just one, okay.
And they can't, we have to
So
give
you
them
didn't
a
have to
full-
bid this out, you can just expand it?
Well, the reason we're doing this is because this is exigent need. So we do have approval for a request for proposal that needs to be issued, which we are working on and should be taken care of, which you've already approved. So this is just these emergency cases that come up. We find a lot of times that when it comes to this service population, our agencies can only take a few. They can only take like 2 or 3 folks because the needs are so great and it's difficult to staff them. So it's, we think we have enough and then we find out this agency can't take them because they don't have enough nurses or whatever. So we just, if somebody comes in and says, I can do this, and because of the nature of the service, it's it's life-sustaining service that we need to get these providers as soon as we can when the need arises, so.
Thank you.
Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. All right, move on to item 6, receive and file. We have nothing to receive and file. Number 7, resolutions. We have none yet this month. Number 8, other agenda items. We'll start with Nick. We'll go around and then we'll finish with Dave. Nick, go ahead.
Yeah, there have been a whole lot of things going on, both administratively and legislatively. From a policy level, the state, David, was kind enough to send most of it around if you had an opportunity to read through all of that. And I've gotten some other ones that I'll send around as well, some additional information. And we've been talking, as you know, we talked with Bob Sheehan. David's been talking with the PIHP boards. I've had communication with some of the advocacy organizations. So the bottom line is the department had pulled back on 298, but wants to do not only integration, financial as well as care level, and the financial one's the sticky one still, but also wants to do some general reform internally. And there are, apparently now it's not the Senate chair is not talking about a general reopening of the mental health code, but there are some changes to the mental health code that are being sent around. Bottom line is we need to set up another legislative and policy committee, look at all these different options, see if we want to recommend to the full board to take positions on any or none or all of them in resolution form. And so we need to set a date for the meeting. Now, I've looked through the calendar here, and, holidays are coming, and that all makes it. And I don't know if there are any hunters in this group. I don't hunt, so I don't know. Well, there may be. I don't know. I just know I don't. I looked at, and because of Phil's schedule, although the legislature's going to be out, so it may not be as big a deal, but the Mondays and Fridays, which would be the most likely days, I think, for a 7:30 meeting that I've opened are I see November 22nd, 25th, December 2nd, December 6th. There's not a great deal of urgency, so it's just more a matter of who's available when. Well, we were doing Fridays for 7:30 meetings because of Phil. That's Phil's fault. No, it's because it's the legislature's fault. Although they're gone like for 2 weeks, so we could do it a different day. Say what? Right. But if we were looking at the week of the 22nd, then of November, next week, that too soon for you? Or because then, when's the next week? Or wait a minute. Well, the following week is Thanksgiving, so And the 26th, we have a full board meeting, so the 25th is the only thing that time. 19th, oh, I'm sorry, I'm on the wrong month here. Well, I don't know what I'm doing here. You move full board to the 19th, and Thanksgiving is when? Oh, I thought it was earlier this year.
Your 22nd looks pretty good. And I'm not a voting member.
I'm trying to get to the right date. Okay, well, then Monday's not as good, but what is good next week?
If you do it at 7:30, you know, you and I will be there for a 9 o'clock meeting already on Tuesday. But that's the 5th week.
That's Tuesday of next week. Oh, shoot, this stupid thing.
We have CAC.
The CAC is on what?
The 19th.
19th of November. So, and we have a 9 o'clock, so that would work for Linda and I, if it would work. Get it over with.
Okay, there's a recipient rights on the 15th at 7:30. We have full board the 19th at 6 o'clock. And then, yes, this is TBD.
Yeah, we're all on recipient right.
Okay, so the 19th at 7:30 in the morning. Linda's good. Megan, are you good? Okay. Are you on that committee, Brian? Okay. Dana? Good?
Lori?
Not good for Kathy. I don't know. I don't have my list.
Well, no, there were always members, they just never
No,
called.
Brian, you're not. It's Nick, Linda, Megan, Ryan, Dana, myself, and Kathy is ex officio. So you don't even really have to be there. Do we want to change it for Kathy?
The 19th is next Thursday.
Kathy really doesn't want to be there, so let's plan for 7:30 a.m. on the 19th in the admin building. Good? Wonderful.
Fine with me.
Nick, do you have anything else?
I don't think so. Let me just double check. Nope, I'm cool.
Linda, you're up.
I don't know if you recall, but I can't think of her last name. If somebody knows Lori from Macomb NAMI, I can't think of her last name. But she came here and gave a presentation about something that NAMI kind of in Macomb County, there's the larger tri-county area, but they meet at Beaumont Hospital, and it's difficult for Macomb residents to go there, and they're not as connected. So there's a Macomb group that has started to meet at Henry Ford Hospital on the second Tuesday of the month. She came and gave us a presentation and brochures maybe a year ago or 9 months ago, and I can ask her to come again. But someone contacted me about problems they were having with their family, with a sister they took in who won't take her medicine, and she bought an airplane ticket, so she has money. She bought an airplane ticket to go to California because she heard that was really good to be homeless on the streets in California. So it was this big worry for the whole family, and the woman wasn't safe and so forth. So I told them about the meeting at the Macomb, at the Henry Ford Macomb. And it's so unique because they have a meeting for family members. At the same exact time, there's a meeting in another room. In fact, it's room 6 and 7 next to each other, where there are peer support people, and the people who are receiving services for mental health can go and have a meeting of their peers, and it's kind of directed by peer support. So I just want to remind people that that's an availability, and just kind of brag on Henry Ford Hospital and Macomb NAMI and the service. My friend texted me afterwards, it was last night, and she texted me this morning and said that she was so thinking that she was failing her sister, and she was so afraid every day that her sister was, the behaviors her sister had were very dangerous. And so she was able to be there with other families and understand that she was in the middle of this whole mental health process, and she was really doing some things right, and she got a lot of direction and support. So it was a big success for her family so far. And the sister actually went to the peer meeting. She had refused to go, but she actually went with her. She says she's not going the next time, and I'm betting that she is. So, so that's good.
Any other board members with anything else before I turn it over to Dave? All right, fire away.
Good evening, everybody. As Nick mentioned, there's a lot going on. I summarized most of that in the email. We're waiting for additional updates to come from the department. What I wanted to stress this evening was the budget part of this committee. We received, they changed the Medicaid capitation formulas for this current fiscal year. We got that detail, and we made projections based on that. The association made some projections for each of the 10 PHP regions. We were expecting on average about a 5% increase. When we received our funding in October, everybody spoke up and was having issues kind of connecting the actual funding to what the new formulas showed and what our projections were expected to be. The most significant one came from Dr. Kangas from the UP. Their projections showed about a $5 million increase. When their funding file came over, it was $56 million more than they expected. And yeah, he kind of knew that was an obvious error. We met with the department last Thursday morning. They did make a mistake in the eligibles. Our new funding formula has categories based on whether or not the individual, the eligible person, is enrolled in a Medicaid health plan or not. And they messed up in that area. So the October funding is bad. We cannot make projections at all based on that. We have providers, of course, are calling us going, hey, I heard you got your Medicaid capitation rates went up. Can we talk about our rates? And I'll be doing a memo out to our provider system to let them know about what's gone on at the state level. They do plan to correct it for November. The issue then would be our November funding file would be a corrected file. It would include dollars corrected from the October file. So we might not know what our actual regular funding file will look like until near the end of December. Hopefully, when they give us the corrected, when they correct October, it'll be clearly described in a distinct part of the funding file. But history tells us that they tend to give you one kind of lump sum file and go, here, we fixed it, and then we end up having to try to decipher what that all means for us. So funding's not, we can't make projections yet. People are asking, I'm asking, what's it look like? Did we get the increases we were supposed to get? And currently there's no answer to those questions. As soon as I know, you will know, and sorry I don't have better information for you, but I do have it it's in the notes from our meeting last Thursday that there was a mistake for about 41,000 people statewide, but it ended up having significant impact on the Milliman model. So stay tuned.
Nick, you got a question or anything? Okay. All right, anybody have any questions or comments on what Dave had to present? No? Okay, good. With that, we will close other agenda items and go to hearing of the public. Anybody from the public wishing to address this body, going once, going twice, we will close the hearing of the public, and with that, we will adjourn. Thank you, everyone. Have a good night.